Hello, and welcome to HC4620, Module 9, Portfolio Assignment, the Informatics tool. This Informatics tool is based on the American Heart Association's Simple 7 tool. So let's get started. It's here, a stroke prevention risk assessment tool. You enter your health information on smoking status, body mass index, total cholesterol, blood pressure, and fasting glucose. The tool will return an assessment score based on the provided criteria. What are some of the uses for the provider? Well, providers can recommend the tool to initiate discussion regarding the patient's healthcare and current status. For this case study, Betty's primary care physician can recommend she use the tool as an initial assessment, then follow up with a clinical discussion with Betty regarding her results, then engage Betty with a medical plan for best outcomes. What are some of the uses for the patient? Well, the patient can access the tool to monitor the progress of their health, and the patient can specify questions to the provider, and the patient is now part of their own health team. What does this process look like for the patient? Well, the patient takes the healthcare quiz, then reviews the results. The patient prepares questions for the physician. The patient discusses the healthcare options with the physician, and the patient implements a plan to discuss how to reduce strokes and maintain quality healthcare outcomes. And what are some of those outcomes? Well, the providers now have a tool to increase health literacy of patients, and the patients have a tool to direct their own care. And payors see cost reduction due to quality healthcare outcomes and less demand for medical services. The population now has a valuable tool to prevent disease, and the treatment is much more personalized. Yet there are challenges. And what are they? Well, providers might need more patient information. The tool might not provide everything. Patients might not be fully disclosing health information, and thus impacting the effectiveness of the tool. And payers may end up spending more on research and development for the tool or not want to spend anything at all. And populations may not use the tool at all. It may not be accepted, thus shelving it. Thank you for listening. That concludes our video. Module 9, Portfolio Assignment, the Informatics tool.